Hello, everyone. My name is Kyle Robson, and today I'm going to be talking to you guys about obsessive compulsive disorder. So, quick definition of obsessive compulsive disorder, or most people probably call it OCD, refers to a set of excessive thoughts that's going to lead to some sort of repetitive behavior. These thoughts are often unreasonable and are based on fears and or need for arranging objects, which is going to lead to this repetitive and compulsive behavior. These thoughts are often recurring as well as unwanted, which may cause some anxiety in someone suffering from OCD. So going into this picture, as you can see on the top left, 1 in every 200 children has OCD. And then 1 to 3% of the population in the United States is diagnosed with OCD. Some common obsessions that occur in someone with obsessive compulsive disorder is contamination, um, feeling your hands are dirty, you need to wash your hands, losing control, harming somebody, or losing important items. And then these obsessions lead into repetitive compulsions, which would be washing and cleaning your hands if you feel they're contaminated or dirty. Orderliness, which prevents losing control. Double checking, as well as following a strict routine. So some symptoms of OCD, they can be compulsive behavior or compulsive hoarding, some impulsivity, repetitive movements, and ritualistic behavior. Also, it can cause some anxiety, leading from the compulsions and need to act on the compulsions, as well as panic attacks and even depression in some people. So, some ways to go about treating this would be some sort of therapy. Talk therapy is often used, as well as psychotherapy, and then medications. And actually, a combination of both therapy and medication is probably the most effective way to combat OCD. So, OCD cannot be cured. However, with treatment, it can definitely be managed to a point where it probably will not affect someone's daily life. However, getting to this point may be difficult for some people as they don't want to change their daily lives. It might be scary for some people. And then this picture kind of shows the thought process of someone with OCD. So we're starting off the yellow, which is the obsession. An example they give is not knowing if they turned off the oven, even after they've checked it once or twice. So after the obsession, it may lead to some sort of anxiety, which can be uncomfortable feelings, and then this person may feel compelled that they need to act on their anxiety so that they can hopefully remove the discomfort they feel. And then after the anxiety, they feel they need to act on it. So they're going to go ahead and check to see if the oven is turned off, and they can even go through great lengths as to travel back from home from work to check it, even if they've already checked it once. And then they're going to be feeling a slight relief that that their anxiety is gone, that they've checked the compulsion. However, this is just going to be strengthened for the future, and oftentimes it's going to be reoccurring. So it's kind of a cycle rather than just 4 steps. And then just some history behind OCD.